Hello, my name is Shirley Evans and I'm Programme Manager for the UK Meeting Centre Support Programme based at the Association for Dementia Studies at the University of Worcester. And I'm going to talk briefly about how meeting centres have continued to support people affected by dementia and flourish in the UK despite the pandemic. So firstly, what is a meeting centre? Well, in a nutshell, meeting centres provide local, community-driven, ongoing, flexible, post-diagnostic, person-centred support for people living with dementia and their care partners. Meeting centres are provided with a small permanent team of staff and volunteers trained to help people and families cope with the challenges that dementia brings. A structured community planning phase provides inclusive engagement from health, social care, voluntary organisations, community groups, and any local movers and shakers in supporting people living with dementia. The aims of the programme are to help establish new meeting centres across the UK, develop a community of learning and practice, and develop resources and training and support data collection. So we have ongoing data collection, but during lockdown, we included some interviews and focus groups with people because a range of remote approaches, both technological, using online platforms such as Zoom, and non-technological, were implemented alongside limited face-to-face contact, which after about 3 months were garden visits and going out for walks. Regular meeting centre activities were adapted using the different approaches, and it was possible to map all the adaptation and coping models support strategies that underpin meeting centres to the activities delivered in this way. Also, meeting centres were able to adapt rapidly to continue to support people to adjust to the changes that a diagnosis of dementia brings. Alongside the interviews and focus groups, our ongoing data collection includes attendance data, baseline characteristics, health and well-being, satisfaction questionnaires, case studies, and contextual information, which help the meeting centres to evaluate what they're providing, but also absolutely crucial for gaining funding. We also have a PhD studentship investigating value and social return on investment for the Worcestershire meeting centres, of which there are now 8. And Nathan Stevens is speaking about this elsewhere at the conference. And we have an NIHR funded realist evaluation of meeting centres, which is investigating sustainability. So quite a lot of traction going on there with our data collection and building on the evidence base of meeting centres, which we believe has really impacted on the expansion of meeting centres across the UK. At the start of COVID and lockdown, there were 13 meeting centres in the UK. And as I speak now, there are 32 funded meeting centres across the UK. So they have grown in number despite COVID and the pandemic. And this is partly due to the data collection, but also much to do as well with the community of learning and practice, with the national reference group, with our fortnightly managers meetings, providing that sort of ongoing peer support. And also we have developed our training programme, and we've had 3 cohorts of going through our online training programme, including a cohort from Singapore. So all in all, the data collection, community of learning and practice, and a real passion for meeting centres have meant that meeting centres have continued to flourish in the UK despite the pandemic. Thank you for listening to me, and there are contact details.